your blood pressure. And there's just kind of a schematic that shows you that whole thing in 10 easy steps. You get the decreased blood flow to the kidney. That will release renin. That will then combine with angiotensinogen to produce angiotensin 1. That will go into the lungs where the ACE inhibitor will, or the ACE enzyme will hit the angiotensin 2 and create, or it will convert angiotensin 1 to angiotensin 2. The angiotensin 2 is a vasoconstrictor. It will also flow down to the cortex of the adrenal gland here and release aldosterone, and it will also flow to the posterior pituitary, release ADH, and ADH will come back down to the kidney. And the effect on the kidney is to keep sodium. So we retain sodium, and the way the kidney does that is it gets rid of potassium. Okay, so it gets rid of the potassium, retains the sodium, and then the water tends to follow the sodium, and you can read through how all that works. Aldosterone is the salt or sodium retaining hormone, and it stimulates the renal tubules to retain sodium. And therefore, wherever sodium goes, water follows. Okay. Here is the release of ADH. The stressor comes in and it stimulates the posterior pituitary, and this would be angiotensin, this would be the effect of angiotensin 2 and aldosterone, which stimulate the release of ADH from the posterior pituitary. The ADH will come down to the kidneys and tell the kidneys to not have as much diuresis. It's anti-diuretic hormone. It's a hormone that stops urination. Okay. Now here's the release of cortisol. Remember up to this point we've been talking a lot about the so-called catecholamines over here, the nervous effects. Now we're going to shift ground and look at the hormonal effects, and here's ACTH. In this, you'll see we have the alarm in the limbic system of the brain. That goes to the hypothalamus. The hypothalamus will send CRH, or cortico-releasing hormone, to the anterior pituitary. It will release ACTH. The ACTH comes down in the bloodstream, hits the outside of the adrenal gland, and we release cortisol. And then there's a number of cells that are receptors for cortisol. So that's what we're looking at here, ladies and gentlemen. The stressor comes in, the limbic system of the brain is scared, so it tells the anterior pituitary release ACTH. The ACTH comes down to the outside or the crown or the cortex of the adrenal glands, and that will stimulate the release of aldosterone and cortisol. And again, what the effect of the release of aldosterone is to retain the sodium at the kidney. Now, what does cortisol do? Very, very important compound. I want you to read through this and see what it does. It's kind of called the stress hormone. Basically, it breaks things down. That's the way you can kind of look at it. It breaks down glucose, it breaks down proteins, breaks down fats. Because why? Because it wants to elevate glucose. And a small amount of this is very, very beneficial, but you can imagine if it goes on time after time after time, we can actually get into osteoporosis, where it's breaking down bone. So, and that is a condition known as Cushing's disease. You can think cortisol Cushing's. And we'll get into that when we talk about the endocrine system here next, in the next units. Okay? Here are just some of the effects of cortisol. It increases blood sugar. It aids in the metabolism or the breakdown of fats, proteins, and carbs. Now, it will suppress the inflammation and immune system. Okay, and it will also decrease bone formation. Okay. And small amounts of cortisol are very beneficial to us. It gives us quick energy. It stimulates our memory, and it will give us lower sensitivity to pain. So it has, and that's why we use corticosteroid to reduce, if you have an inflammation on your hand, we would use a corticosteroid cream, for example, to decrease that inflammation and decrease the pain. But if this goes on chronically, if you have chronically elevated cortisol, it can be very destructive, and that's the disease known as Cushing's disease. Okay, Cortisol, again, will decrease inflammation, and in turn, it will decrease the immune system. So that's one reason we want to be very careful with it. And that's another reason why we don't want to put somebody on a long-term prednisone or a long-term steroid unless you absolutely have to, because it will, while it will help reduce their inflammation, it can also reduce their immune function. That's why somebody with asthma, for example, we don't treat them with a what's called a systemic. We don't treat them with a pill for corticosteroids. We treat them with an inhaled corticosteroid, which gives you much less steroid than you would get if you took a pill. But sometimes you have to take the pill because you have a very widespread inflammation. So that's how cortisol is used. A couple of other things that will happen in the alarm system: we will increase the output of thyroid stimulating hormone, and this will in turn go to the thyroid, and it will increase the release of thyroid hormone. And thyroid hormone makes all tissues do more of whatever they do. The idea is that thyroid hormone basically increases the activity of any cell that has a receptor to it, and I think almost every cell in the body has a receptor to it. Okay, now some of the other effects of stress. We will decrease follicle-stimulating hormone and luteinizing hormone. That they will be decreased if the patient is under a lot of stress, and that will reduce the rate of ovulation, and also prolactin will be inhibited. Okay. Other hormones that are released in stress, the endorphins. This will help us to control pain. It's a morphine-like substance, and there's a number of them in the body. Okay. Now, let's say that somebody comes under stress, and this has been going on for a while. Eventually, we will begin to go back to a normal state or a homeostatic state, and there we will get the activity of the PNS, or the parasympathetic nervous system. And this is the other side that will help to calm us down and stabilize us and help us cope. Now, this is ideally what happens. So I've been under stress, I've seen the bear in the woods, and now I'm out of danger. Now I can start to slow my heart rate, slow my breathing. Okay, slowly my digestion will return. Blood will start to flow back into my peripheral blood vessels and so forth, and everything will be back to a normal state. Okay, but what happens if this doesn't happen? If I just remain in a condition of constant, prolonged stress all the time? What's going to happen? Remember that Dr. Selye, the first thing was hypertrophy of the adrenal cortex. We're going to continuously bombard the adrenal cortex with stimulus, and it's going to get enlarged. It won't become more efficient. It will just become enlarged. Okay, and we will also suppress our immune system. And what will that do for us? We'll be sick all the time. And that's exactly what you'll see in very stressed patients will come in and say, I can't quit this, I can't lose this cold, and I go from a cold to diarrhea to this to that. And the reason why, they are actually literally suppressing their immune system. If it goes on long enough, it can actually lead to a very serious condition of exhaustion, and this would be a case of Addison's disease, where you would start to get progressive organ failure because you just were not able to keep up the output due to the stress. Okay. Now, what are the diseases associated with profound stress? At the cardiovascular level, stroke, coronary artery disease, hypertension, rheumatoid arthritis at the level of connective tissue. Why would that be? Because you're reducing the immune system, and when you reduce the immune system, this is an autoimmune disease. The immune system can go haywire and start attacking the body. In the pulmonary level, asthma, hay fever, irritable bowel syndrome. At the endocrine level, it can actually become diabetic because of that constant hyperglycemia. Remember that elevated blood glucose is the hallmark of the stress response. Well, what is elevated blood glucose? It's a diabetic condition, a hyperglycemic or diabetic condition. Okay, Just a few questions for you to contemplate. What role will stress play in the onset of a disease? Well, we just reviewed a couple of those. But you need to think, what happens if my heart rate stays continuously elevated? What happens if my liver keeps spewing out glucose? Okay? What happens if I keep that very high rate of respiration? What happens if I continuously stimulate aldosterone? Eventually, you can see that disease states. If I continuously stimulate the adrenal cortex, for example. And then this doesn't even raise the question, what happens to the mental state? People can become anxious, panicky, or if they can't respond to the stress, they may become depressed because they just can't get away from the stress and they just give up. So, and then you can have mental disorders that come about from this. Okay, which of the following is normally not secreted by stress? Well, we know norepinephrine is, cortisol is, epinephrine is. The sex hormones are not, because when you're under stress, that's the last thing you need to do is be reproducing. So the sex hormones will be temporarily sort of turned down so that we can deal with the stress at hand. Okay. Which is the following is not a common manifestation of stress? Okay, tachycardia, that's increased heart rate. We know that is. Diaphoresis, that's sweating. We know that is. Peripheral vasoconstriction, that's turning the blood flow off of the periphery. We know that is. What about constricting the pupils? No, we dilate the pupils. Okay. Okay, well, ladies and gentlemen, this concludes the Unit 1 review, and the next slide, or the next tutorial that we're going to have is for the second unit. And we will be producing that in just a moment.